in joint replacement and hip replacement. So we have a unique case in which sir had operated upon a patient. The patient will also join us soon and talk about it. This is, I think, the most important part about an orthopedic surgeon is not only to relieve us from pain, but increase our chances of mobility, because with so many fractures or anything, mobility becomes an issue. And when a person is dependent on others for mobility, that's when doctors like Pawan Chebi come in and operate something special. And the patient is not dependent on anybody to walk or move around. I think today the focus is that how mobility is so important for us. So without taking much time, I will hand over the entire thing to Dr. Chebi, and he will call on the patient, and then we can take it forward from there.
Consultant orthopedic surgeon here at Apollo Spectra. I have a special interest in joint replacement, sports injuries, sports-related injuries, and most importantly, deformity correction. So here, what happens is when we talk about orthopedics, just like Mr. Vinayak was saying just now, it's not just for pain relief; it is for mobility. So a lot of times we see people with injuries go slowly into a state of disability. So kind of they get into a sort of disability or reduced mobility. They stop playing, they stop running, they stop being independent. Especially this happens in the older age. And nowadays, it happens much more earlier. 50s, 55 years olds, they become dependent on their children, or they're sent away because of some deformity they have, because they're not dependent. So here, this is one of those typical cases when in 2019, a gentleman had an injury to his hip joint, for which he was operated upon somewhere in North America. There, he had put a intramedullary device, that is, fixation of the fracture was done. He was okay for a few weeks only. Then again, on the subsequent follow-up, the doctor told that he had to undergo an exchange of the implant because it is not proper. So this is not it. It went on for at least 6 times. So repeatedly he was in and out of the operation theatre because of this. Then finally, after multiple opinions, he had the so-called stable hip joint, which he managed for a few months. Then, over a period of time, he started developing some shortening of the leg. That is, his right leg started to become short. And he developed a lurch. So every time he walked, he started lurching on one side.
कुमार सिंह है, मैं गोरखपुर यूपी से बिलोंग करता हूँ। 2019 15 अगस्त को मेरा एक वो बाथरूम से निकलते समय पैर स्लिप कर गया था, तो मेरा फ्रैक्चर राइट के पास हुआ था। तो उस दिन 15 अगस्त था, उस दिन तो मुझे डॉक्टर भी कोई नहीं मिल रहा था, लेकिन चूंकि मैं बैंक में काम करता था वहाँ, तो फिर मेरा थोड़ा सा ये करके प्रभाव करके डॉक्टर से दिखाया। तो इनिशियली तो उन्होंने बोला कि फ्रैक्चर नहीं है, कूल्हे के पास फ्रैक्चर था, लेकिन सीटी स्कैन हुआ तो उसमें मेरा फ्रैक्चर नहीं था। तो उस दिन तो हॉस्पिटल कोई खुला नहीं था, तो उस दिन कुछ हुआ नहीं, इंजेक्शन देके उन्होंने पेन को थोड़ा सा साइड किया। दूसरे दिन गया तो वो स्कैन का भी, सीटी स्कैन का भी रिपोर्ट आ गया था, तो फ्रैक्चर उसमें निकला था। तो उन्होंने फिर मेरा ऑपरेशन किया और वहाँ पे रॉड लगा के साथ। खैर वो ऑपरेशन हुआ। इसके बाद नवंबर में मैं थोड़ा सा स्टिक के सहारे चलना शुरू किया, उससे पहले वॉकर पे ही चलता था। तो नवंबर में चलना शुरू किया स्टिक के साथ, लेकिन लिंपरिंग था वहाँ मुझे, पैर जो है मेरा, मैं लंगड़ा चलता था।
Which we thought was or rather about 5 years ago, we used to send this overseas, we used to send it to another country for the design. They will take all the template, ready ಮಾಡಿಬಿಟ್ಟು ಕಳಿಸ್ತಿದ್ರು. This is available in India, this is available in Bangalore now. So we designed this according to his size. Then this is the cup, this is the head. Now here, this is a ceramic head which we have used. So the round thing which is there, this is a ceramic head which we have used. The advantage of this is it is very long lasting. You know, it's very hard and strong, it's very long lasting. It is not very heavy, and also articulation is perfect. So such things you have commercially available also, you have different sizes also. This is the cup on which the ball should sit. And this angle is what matters, you know, so that whether the person limps or not limps, it depends upon this angle. So he had a fracture here, which was fixed with that, and now because of that there was a lot of gap, etc. So this is the implant which we have put. You can see how correctly snugly it is fitting on the sides. It should not be too thick, because if it is too thick, it will pierce the bone. It should be. Dr. Pavan Chappi, I'm a consultant orthopedic surgeon here at Apollo Spectra Hospital, Bengaluru. So this particular press meet is for discussing about a challenging and complicated case of one Mr. Sanjay Singh. He had a fracture of the hip joint way back in 2019. This was operated somewhere else in North India. After multiple failed surgeries for that, which that started off in 2019, he developed a limp and shortening of his right hip joint. So this particular issue was particularly a challenge for a further surgery because of presence of an implant already in the hip joint, the bone loss because of a implant which is eroding the bone around, and also the increased limb length discrepancy, that is increased shortening of the length of the limb. So with all these challenges in mind, we had to design a custom made individualized hip, so that we try to finish the surgery in one stage, which is ensuring or helping the patient to get mobile immediately after the first stage or the single stage of surgery. So keeping this in mind, we used this particular implant, which was helped by Merrill. So this is just the same copy which he has got inside. So we got this prepared and we did the surgery, which took about 4.5 hours. That is to remove the implant, clear the bone, and put a fresh implant. And do all this without any complications. We finished the surgery successfully on 24th of December, 21st of December last year. And it's been roughly about 2 months today, and he's doing perfectly fine. Honestly, I had a lot of doubts when I started off with this, but I was confident that it will be successful because we did our homework well. Our team had done our homework well. And also post-operative physiotherapy, which is an essential part, and Mr. Sanjay Singh did cooperate with us to do all the physiotherapy activities properly without any hiccups. And here we are, standing continuously with us, standing straight, Mr. Sanjay Singh.
Thank you.
Thank you.